Aia Vitality. Your health is every choice you make. We are part of a global wellness program with over 1.65 million members in AIA across Asia. And in Singapore, we have more than 100,000 members on AIA Vitality. Members live healthier by knowing their health through online health assessments and screenings. They improve their health by logging exercises and enjoying the rewards to keep them going. And indeed, members are making improvements in their health. Even the vitality age gap has narrowed to less than a year. Best of all, you earn points for every activity. The higher your status, the greater the rewards, including up to 15% off insurance premium on selected AIA plans. To keep you going, there is the weekly fitness challenge, with personalized targets to help pace and improve your fitness. When you complete the challenge, you get a spin on the Vitality Wheel to earn Vitality Coins, which you can use at the marketplace. That's not all. You also earn AIA Vitality Points for completing these activities. And very soon, you'll be on your way to Platinum status. And we sweeten the deal further with many exciting partner benefits that you can enjoy. With AIA Vitality, nothing gets better than a healthier you. So get onto AIA Vitality today, because your health is every choice you make.
Better sleep, better work. Employees need enough rest to be productive. Find out how we can help you lead healthier, longer, better lives. This is an unhealthy workplace.
Quit calling, please.
This is a healthy workplace.
We're happy to help. Call us anytime you want.
Unhealthy,
Told you to use Helvetica, right? But everyone knows Ariel is better. You got problem, is it?
healthy.
The presentation was awesome, bro. Thank you, bro. Your presentation was awesome too. Yours was awesomer.
Healthier employees are more productive.
What do you think?
Find out how we can help you lead healthier, longer, better lives.
Good morning, ladies and gentlemen, and thank you so much for joining us today at Health and Wellness Live 2020 by AIA. My name is Aditi Sharma Kalra. I'm the Regional Editor for Human Resources Online, and today I have the double honor of hosting this wonderful panel discussion on a very relevant topic. Now, I hope you're familiar with Human Resources Online. We are a media and events brand that is passionate about the progression of HR in and around Asia, which brings us to the stage today where we have quite a relevant topic on hand. Now, our topic today is From Payer to Partner, Revolutionizing Healthcare. And I'm sure this topic will resonate with many of you. But before I get into that, allow me to give a quick introduction to our wonderful panelists. Seated the closest to me is Alvin, who is the Chief Corporate Solutions Officer at AIA Singapore. He thus leads the corporate solutions business for Singapore's largest employee benefit insurer, covering 1 in 3 workers in the country. Alvin is passionate about working with AIA's corporate clients to build the people who build their business, increasing the value of employee benefits and investigating big data to manage healthcare costs. Thank you so much for joining us today.
Thanks, Aditi.
Pleasure. Seated right next to Alvin is Brian Ko, who is the CEO and founder of WhiteCoat, a homegrown digital healthcare provider offering on-demand telemedicine services through innovation and data-driven technology. Interestingly, WhiteCoat is Singapore's first Ministry of Health approved telemedicine practice, so kudos for that.
Thank you.
Seated on my far right is the lovely Dr. Alan Ong, who is the Medical Director for AIA Singapore. He is a seasoned healthcare professional with over 15 years of experience in the public and private sectors across Singapore's healthcare system. And he has also worked as a clinician on the ground and across multiple portfolios in the Ministry of Health. Thank you so much for joining us.
Thank you.
Well, as you can see, it is quite a power-packed panel that we have here. So let's start right into the discussion. Before that, let me build a context. Now, what comes to mind when we think of the term insurer? I think many of us think of insurers only when it's time for us to make a medical claim, when we've unfortunately fallen sick and we need some help. Fortunately, our relationship with insurers has been changing significantly in recent years. Wouldn't I be right to say? Now, all of us remember that age-old advice on how prevention is better than cure. And I think you would all agree with me when I say that rather than seeking medical advice only when we've fallen sick, why not we try to use the opportunity to come up with healthy actions or healthy habits so that we can stay healthy and strong as long as possible and take a more preventative route. Well, I think this is exactly the route that we've opted to take, which is why we've planned this panel discussion for you today. So let's get started. We are hoping that you will be able to explore the role that your employee benefits insurer plays in revolutionizing healthcare and how you can partner with them to create a healthier workforce. So let's get started, panelists. Thank you once again so much for joining us. Alvin, I would like to start with you in terms of really setting the context for all the viewers that are joining us today. How far have you come in your healthcare journey and revolutionizing it?
Sure, yeah. Thanks Aditi for the kind introduction. And good morning to everyone and all our viewers. Welcome to AIA Health and Wellness Live. We hope you're staying safe at home. I know after this there will be Dr. Leslie who will be doing dim sum, chicken dim sum. So that's for the body, but in the meantime, this is for the mind. Healthcare is something very close to our hearts, right? Healthcare is not a matter of if, but when. All of us, whether you're at home or seated here, will need to use healthcare services at some point in our lives. And I would like to just share a little personal story because I think that's the best way to relate on where we're coming from. My dad, who was 5 years ago, 70 years old, he was suffering from prostate cancer, which is fairly common among males in Singapore. And he needed to do a prostatectomy, which is to remove that prostate. And so I followed him like a dutiful son through his checkups with a private urologist. We were due to do the surgery. The doctor gave us the financial counseling form, which was $30,000. And I knew that my dad didn't have great insurance cover. I need to cough out maybe the difference of $20,000 in cash. But still, like any other son, you want the best for your family, your loved ones. And you said, okay, yeah, let's do it. Let's go for it. So the surgery went smoothly, thank God, and everything the surgeon did a great job. When the surprise came to me when the bill came up to be $40,000, $10,000 more, and when you're paying cash, you really feel the difference. Yeah. And I was very shocked, so I asked the doctor very politely what has changed from the financial counseling to the day itself, and they told me the reply was that the cost of the surgery and the treatment operating theatre cost changed on the day itself. And for that one moment, I realized that the average patient is vulnerable and the average doctor almighty. And it's precisely this reason why insurance companies have to play a role and place with our resource, our expertise, people like our medical director, Dr. Alan, to really work hand in hand as a partner through your healthcare journey. How do we do it? There are a couple of ways and maybe three key ways. First, we want you to know your health, establish that baseline through a lot of our partners like WhiteCoat and health screening partners to understand where your health baseline is. And then we want to walk you through that journey to improve your health. Through our workplace wellbeing program powered by Vitality, we want to help you to make small baby steps to improve your health. And lastly, if something really does happen, we want to be there with you. We want to walk through with you the entire journey. And that's why we really want to be not just a payer, we want to be a partner in your healthcare journey.
Thank you so much, Alvin, for summing that up and for sharing your personal story as well. And I do appreciate the 3 steps that you've shared with us. So I would like to come to you in terms of setting the context, Dr. Alan. How has your journey been in this space?
Yeah, sure. So I think traditionally we have seen insurers operating purely as payers of healthcare bills. In other words, the role of an insurer has traditionally been to take away the financial risk that the policyholder has when you're faced with a health event. But if you think about the role of an insurer more broadly, there's really a lot more that an insurer can do, and Alvin has articulated that very well in the sense that we can do a lot more to help our customers know their health better, improve their health, and get to the right treatment when they're ill and recover smoothly. I think one of the reasons why I joined insurance, having come from a health background in health policy, is because I realized that payers in the healthcare space have a large role to play in determining the outcomes that you get from the healthcare system. And we have, as payers, a lot of influence on 3 aspects of how the healthcare system performs. We have a lot of influence over the behavior of the people that we cover. Right? What we choose to cover, what we choose not to cover determines what our policyholders choose to do or not do. to a very large extent. So for instance, if you cover prevention, then it's more likely that policyholders will go for preventive care. If all you cover is hospital-based care and you don't cover anything else, then it becomes more likely that policyholders will choose to get treated in a hospital as opposed to what may be a lower cost setting. What we choose to cover or not cover also impacts how providers behave, and you can see that in many instances. If an insurer chooses to cover a particular drug, device, or type of intervention, then you tend to get increased use of that type of intervention because coverage is available and patients are more able to afford it. Conversely, if you choose not to cover something, then that sort of intervention it becomes much harder for that intervention to grow. So for instance, in the field of telemedicine, that's something that's relatively new, and in the past there have been, insurers would be quite reluctant to provide coverage for telemedicine because of the perceived risk of abuse and so on. And as a result, telemedicine wasn't able to grow as fast as it could have. But now that insurers have become more open to the idea of covering telemedicine, then you see a growth in adoption of telemedicine. I guess the third aspect to how insurers play an important role in making sure that we have good healthcare is how an insurer chooses to structure the way in which healthcare is financed impacts the long-term sustainability of our healthcare system. So if we structure it without adequate controls, or we structure it in a way that incentivizes very high-cost care that is not cost-effective, then you end up with ever-escalating costs. And conversely, if we structure it in such a way that encourages people to be cost-effective, that it drives people to try and choose quality providers, it drives providers to try and improve quality, then you end up with a more sustainable healthcare system.
Thank you so much. Really appreciate the points that you've made. And I think it comes down so much to the actions and behaviors that we as healthcare providers can encourage so that we can set those healthy habits in motion as early as possible. So thank you so much, Dr. Allen, for providing a context. Brian, I'm going over straight to you. You've got an exciting background as a healthcare entrepreneur. So talk us through your journey.
Yes, thanks, Aditi. So I think it's really interesting times we are in. If you look at where we are here today and streaming this session to you when it would have been in a live venue, I think what we've noticed is that we look at today's landscape with COVID-19, on the backdrop of COVID-19, what this has really done is really serve as a catalyst for the increased adoption of virtual delivery healthcare services, such as services that we offer like telemedicine services. And this is also amidst the whole backdrop where there is fear of disease transmission going down to a physical brick and mortar clinic, work from home arrangements. I'm sure most of us during this period would have worked remotely or have staggered working hours. This really comes in at a very timely point where we can provide accessible healthcare to everyone. And working with partners such as AIA, actually even prior to COVID-19, they actually had the foresight, and working with the two gentlemen here, we actually said that this would be where healthcare will go eventually. And I think it's really in keeping with the ethos from AIA, where they're transitioning from just more than just a traditional paymaster and really trying to look after
around. It's been a tough year. It's been a very uncertain year. So in the context of the pandemic, how would you say healthcare needs of Singaporeans have changed?
Yeah, I think thanks Aditi for raising that. I think it's obvious to all of us the fact that we are watching this even from home virtually. The world has changed. And there are many impacts, right? COVID-19, people, Singaporeans are worried about job security, they're worried about the disease. But I think for the workforce, the two major ones are engagement and mental health or mental wellness. I think these two components are very critical. So I thought I'll just share a little bit again. It was during the circuit breaker sometime in May. And we've been working from home quite a while, a couple of months, and we've no end in sight, right? The world just felt so joyless and transactional, and people were chasing you for 8 o'clock meetings, jump into calls back to back. So really, I just wake up feeling so joyless, and I think that really took a burden on my mental health. And it's a recent survey by AIA actually says that 30% reported a decline in mental health due to COVID-19. So from that experience, as I was asking around, I realized that I was not alone.
Yeah.
There were a lot of people like this in the workforce that were suffering from this. And we wanted to make a difference. We wanted to do something in line with a promise of helping people in the Singapore workforce.
Yeah.
That's when we did a pilot with Potential Project, a global leader in mental resilience for about 800 of our participants.
Right.
And they only ask you 2 questions through this 4-week course.
Okay.
One, when you come in, what are you experiencing?
Okay.
So you say, I'm tired, I'm happy, I'm stressed, and so forth. And 40% had negative emotions.
Oh my.
Yeah, and at the end of the entire training session after 4
Right.
weeks, the same question, what are you experiencing?
Okay.
And only 8% had negative emotions, and
Wow.
the vast majority had positive emotions, about 80% are positive. So I think from that pilot, we realized that, hey, it works, mental resilience
Yes.
works. This is not just something that we talk about.
Yeah.
And we're very excited to roll this out from next month to all our customers, our corporate customers, as well
Yeah.
as our employees.
Yeah.
Really help you to build that mental resilience
Yeah.
so you're able to better cope with the current situation.
Thank you so much for sharing that, Alvin. I think it is so reassuring and so encouraging that mental wellness, which has often been a topic that has been so taboo, it has always been in the shadows. We're finally talking about it openly, and not only talking about it, but we're addressing it on a stage like this. So it's great to see, and exciting news indeed that the pilot is going to be converted and launched soon. So very, very happy to hear that. Thanks for sharing that news. Now, I'd like to go to you, Dr. Alan. I know AIA has been taking a lot of initiatives in moving from a peer to a partner mindset, and that has involved you to take up many more initiatives for your corporate customers. Would you like to share with us some of them and a little bit about your journey along this transformation?
Yeah, sure. So I think when we think about what AIA as an insurer can do to become more of a healthcare partner to our customers instead of just being a payer,
Yeah.
there are probably 5 aspects to this. Right? So the first is we need to help our customers, or rather the lives that we insure, we need to help them stay healthy.
Yeah.
Second is that we need to make sure that they get appropriate screening. That means screening that is evidence-based and that's at the appropriate intervals, so that if they have any problems, they get picked up before they become
Right.
serious.
Right.
Third is we need to make sure that people get to the correct health interventions. So
Right.
see the right doctor, get the right level of care, get the most appropriate care, and get quickly managed so that your problem is treated effectively.
Yeah.
And then finally, we need to make sure that after that, our lives that we cover are properly supported on the route to recovery.
Yeah.
So from AIA's perspective, what we've done is we've tried to partner with relevant people, develop relevant programs across this entire continuum, so that at every step of the way, the people that we cover are
Yeah.
properly supported. So in terms of building healthy habits, we know that a lot of this revolves around getting the right diet, getting
Yeah.
exercise, making sure that you're taking care of your sleep, making sure that you're taking care of your mental health.
Yeah.
And we have workplace wellness programs in place for that. We have a broader workplace vitality kind of framework, and it's all about helping to support our members so that they find it easier to adopt some of these healthy habits, which we know is not always that easy in real life.
Yeah.
Second, when it comes to screening, we have active screening programs in place for the people for our corporate customers. We've partnered with WhiteCoat to provide health screening as well, that can be delivered on site and in homes. And the idea here is really that we want to be able to help our customers the employees of our customers pick up health problems early, because it's always a lot easier to solve a problem when you pick it up early rather than wait for complications to develop. Now, and then in terms of getting people to the right care, so if you, for many of our insured customers, we have provided lists of preferred providers, and so that you know who are the providers that you can go to, such that the care process is more streamlined for you.
Yeah.
And then finally, in terms of supporting our customers on the road to recovery, we partnered with providers like medics to provide case management services, so that if you need care that extends a little bit beyond just what the doctor does for you at the point of care, we're able to provide that service.
Well, thank you so much for sharing that 5-step strategy with us. I think not only is it very comprehensive, but it's also very holistic in really catering to the needs of employers or the corporate customers. And you know, ladies and gentlemen, you heard what Dr. Alan said. Eating right, sleeping well, and exercising are some of the healthy habits that we really need to look to form as soon as possible. Now, Alvin, would you like to add any further initiatives onto this?
Yeah, I think maybe just share a couple of thoughts on how AIA is really moving from payer to a partner.
Absolutely.
We really want to partner you in your healthcare journey, and this is something we are really obsessed, right? So we are not, we are all about life, not about death.
Yeah.
We are all about a better you, not about fear, and we are all about partnership, right? Not just paying.
Yeah.
And that's really something very fundamental to what we believe in. And really, we have a vested interest in this virtuous cycle, if you think of it.
Yeah.
We want our customers to be healthy, to live a better life, and we also benefit, right? We benefit as organizations with lower claims and better experience.
Yeah.
So it makes perfect sense that we partner each other towards this virtuous cycle.
Yeah.
You know, based on the WHO, 70% of the death worldwide are caused by non-communicable disease, be it diabetes, cardiovascular diseases, cancer, and a lot of it is correlated to our habits.
Yeah.
You know, smoking, alcohol consumption, not enough sleep. A lot of it are correlated, and so we are getting wealthier, but we are not getting healthier. And there's a real need for us to work with each other to understand where your health baseline is and to help you improve that journey. So we've done a lot of things through our workplace wellness program. Thank you for all our Vitality customers who are so active and you know, really so engaged with our program. We really want to make the program as meaningful and engaging as possible for you as well.
Thank you so very much, and good job to all those AIA Vitality customers who've been getting their steps in and really following everything that's been asked of you. It's definitely keeping you healthier, isn't it? Now, talking about healthier businesses, I think my next question to you really drives from a source of AIA doing so much of research and managing its data in terms of identifying talk points for employers and businesses to consider. So, Alvin, perhaps I could lead you into this. What is the cost of unhappy and unhealthy employees to businesses?
I think if you look at it at a glance, sometimes it's very hard to quantify. What is an
yes.
unhappy employee? What's an unengaged employee, right?
Yeah.
But if you really think about it carefully, there is a real cost to it, right? So you actually have reduced productivity, you have increase in MC days, you have increase in medical costs, and a lot of it are quantifiable. If we look at one of the studies that we did, on an average employer lose on MC days as well as what we call absenteeism and presenteeism, being in the office about sick, 51 days on average.
Wow, 51 days.
Per person. So if you multiply by the number of employees and you multiply by the average daily wage, an average Singapore company incurs just on MC days and loss of productivity about $750,000 to $1 million every year, which is a shame. It's a lot.
It's a shame.
And then you add on top, you know, unhealthy employees claim more on the insurance program. It leads to higher premiums. So really, there is a lot of cost. And it is even more so in this current situation where everyone is working from home. You can't force employees to be engaged. They are either engaged or they are not engaged.
Or they're not,
Right? They could be on the meeting, but they could be disengaged.
Absolutely.
So I think even more so in the current situation that employers need to focus on workplace well-being. They really need to pay attention to the engagement of their employees. And you really want them, it doesn't matter where the employee is working, but you need them to be engaged and healthy.
Absolutely, you're right. Remote working has proved so challenging to really measure engagement and unhappiness levels. If my colleague is unhappy, I can't just walk up to them and offer some comforting words anymore because I don't see them. So it is a real challenge for us to measure, but thank you for putting a figure to it. Dr. Allen, would you like to add to this in terms of perhaps the results of some of the recent polls?
Yeah, but perhaps before I talk about what we've discovered in some of our research, I think it's also interesting to note that workplace well-being is not just important for our employers. We as adults, we spend about about 1/3 of our days at work, or if not more, if you count all the unofficial work that happens after office hours. So really, how your workplace supports you in maintaining and improving your health is a big part of, is a big part of how your health is going to turn out to be, simply because you spend so much of your waking time at work or doing work.
Absolutely.
Now, in terms of what we've discovered, in some of our research, we conducted an AIA Real Rewards poll in mid-June of 2020. We surveyed about 875 participants to try and figure out how people were responding to all the changes that have been wrought as a result of COVID-19. And one interesting thing was that 75% of respondents reported that they had experienced at least one positive health change as a result of the pandemic.
Wow.
And 30% responded improved mental health. However, 30% of those surveyed also reported a decline in their mental health due to increased stress and anxiety.
I see.
So there's a bit of divergence. I think people are experiencing different things depending on how exactly their work from home arrangements are panning out, or whether or not they're able to really work from home.
Yeah.
So the good news is more than 2 in 5 of the respondents reported that their sleeping habits had improved during the period. Maybe it's because you don't have to wake up so early to rush down to the office.
Yeah.
This is in contrast to a 2019 study where we found that 56% of Singaporeans get 6 or less hours of sleep per night, and the normal recommendation for an adult is something like 7 to 8 hours.
Absolutely.
So really, Singaporeans as a whole are not getting enough sleep, and we share this in common with many other highly developed societies. So it's good that as a result of the pandemic, more of us are able to get more sleep.
Yeah.
But I do think though that some of the emerging mental health issues around people feeling isolated when they are at home, or people feeling that they are unable to unplug from their work because the work now catches you wherever and whenever.
True.
Those are things that we do need to look into.
Absolutely. I think the findings have been very encouraging on some fronts, and on the other fronts I think they have given us some very actionable talk points that we need to start tackling now quite seriously. And one thing I noticed you mentioned, Dr. Alan, is mental health once again. So Brian, I would like to bring you into the conversation at this stage. In terms of the work that you're doing, how is telemedicine able to support us in terms of really tackling mental health challenges?
Sure. I think as shared by both Alvin and Dr. Alan, the prevalence, especially of work from home arrangements, has really caused an increase in the number of mental health concerns.
Yeah.
So if I just look at my own team, we did a recent survey. I think some of the reasons they commonly cited were actually loneliness because of the lack of social interaction with friends and colleagues. And I think the other reason they cited is that the pressure they feel, losing track of time working from home, that they always feel they have to be on 24/7 and don't really have the time to unplug and unwind. So I think this is where we come in very nicely, because through a video consult, what we're able to do is to provide a very safe, secure and timely avenue for patients to access such services.
Right.
And actually working with AIA, we're very pleased to share that very soon we've actually structured and curated a very balanced mental wellness program, which will also entail teleconsultations and video consultations with psychologists.
Right.
So we actually look beyond that actually during the circuit breaker, and I think Dr. Alan shared a bit in his earlier segment that we actually also rolled out a chronic disease management program.
Yes.
So it was very much targeted at those with existing chronic illnesses to really give them peace of mind and continuity of treatment during this period. So what this really entailed was that we were able to provide them with a similar in-clinic experience by having a team of phlebotomists and nurses going on site to their homes to do repeat blood testing for them.
Okay.
All their results are then digitally uploaded into our application, and this really facilitates a tele-review with their doctor.
Right.
Following that review, patients need repeat medication and additional management or referrals. That's something that we can facilitate as well.
Right.
So I think it comes as no surprise, especially during this period, that a lot of individuals who have some inertia actually stepping foot into a physical clinic.
Yeah.
And I think that's one of the reasons, tying back to mental wellness, why patients want this avenue as well.
Absolutely.
Because some of them still feel the stigma associated with having to go to a physical counseling center or to a doctor for treatment.
Absolutely. Thank you so much for building context into how you're tackling some of the challenges. For example, the inertia or the fear associated with stepping out and going to the clinic. And I think well done on the launch of the new program as well. It would be great to later talk about some of the adoption and participation on these new programs as well. So, Dr. Alan, I know we've talked at length about how this transformation is taking place and how AIA is quite leading and at the forefront of moving from this payer to a partner mindset. I think my next question to you would be, talk to us a little bit more about AIA's role in terms of revolutionizing healthcare. There's a lot that you're doing. You're working with partners like WhiteCoat. Would you share with us some of the things that are on your agenda when it comes to really revolutionizing what we know healthcare at the moment?
Sure. So I think in terms of how AIA sees, how we at AIA see our role in moving from payer to partner, there are probably three aspects to this. So the first aspect is we need to shift our financing to what we say matters. Right?
Yeah.
Traditionally, we have spent a lot of money on hospitals, on doctors, but we need to shift our financing to place equal amount of emphasis on prevention and investing in helping people build healthy habits. The second is that we can't do all this by ourselves, and we are by no means a one-stop shop of expertise on all aspects of healthcare. So an important part of what we see as our role is to stitch together different services for our customers so that our customers get access to an ecosystem of providers that covers all of their healthcare needs, and they can get access to this ecosystem in a seamless manner. And I mean, so Vitality is one such service. Telemedicine is one such service. Personal medical case management is one such service. We don't provide some of these services. We don't provide in-house, but we want to stitch them together so that it is seamless for our customers to access and experience these services through our platform. And then I think the third aspect to what we need to do as a health insurer is we need to be willing to take some chances and experiment on things that may not, where we may not always be sure of the immediate payoff in terms of finances. And really the idea here is we should let what we think we should do what is correct from a health perspective, and that if we do what is correct from a health perspective, we believe that the financial results will naturally follow. When I was still in the public sector, there was an old professor who had said something to me that has stuck with me to this day, which is that what he said was that the best care is the cheapest care, right? And what he meant by that was not that, we should go out and find the cheapest possible of everything and get your healthcare from there. What he meant by that was that if you deliver people good healthcare, right, healthcare that is of high quality in all its aspects, from the preventive end to the treatment end, then what you will end up with is lower costs overall. So it is not true that that you need to spend more money in order to get better results. You can get better results by spending less. And if you get the best results, you're probably spending less than someone who is not getting results that are as good. Now, in terms of practical programs that we have put in place to try and stitch together this healthcare continuum for our partners, I think the key ones that I would like to talk about are, so we have a workplace wellness program, and the whole idea here is to help our corporate customers to promote wellness, to promote the health of their employees. We have Vitality, which is a broader umbrella for all of the wellness, all of the health promotion kinds of initiatives that we do. We have partnered with WhiteCoat to provide telemedicine, and telemedicine is something that for which we see adoption increasing, and we believe that this is going to be a mainstream way in which medicine gets delivered in future. It's no different from how nowadays you don't go shopping anymore. You buy all your stuff online. There are many health services that can be delivered online, and we see this as a growing field, something that will make things more convenient for our customers. And then finally, we've got, as mentioned earlier, we have a personal medical case management service in the form of medics. And the whole idea there is that there's a whole gamut of stuff that a person needs when they have a serious medical condition. You need someone to tell you which doctor to see, where to go. If you have questions about your treatment, you need to be able to ask someone about questions about your treatment. And the doctor can't be there to answer all your questions 24/7. So what we've done is we've partnered with medics to provide what they call a personal medical case management service, where you have someone there on standby for you 24/7 to answer all of these questions that you will naturally have, that you will inevitably have when you encounter a serious medical condition.
Very unique programs, and I think I really appreciate the way that AIA is trying to work throughout the entire healthcare spectrum. So whether you're at point A, whether you're at point Z, it's almost like an entire menu that can benefit your corporate and individual customers in terms of what stage of the healthcare journey that they're at. So I think it's very encouraging to see and very reassuring for businesses to know about these programs. Now, another thing that I would like to check with you on, Alvin, I know that you've got so much data at your disposal when you're coming up with these programs that Dr. Alan has mentioned. So what currently would you say is the role of data in making the healthcare system better, more optimized?
Yeah. Thanks for asking that, Aditi. I think data is very important, but insights are more important. So the role of analytics is to turn data into analytics and analytics into insights, right? Because unless you act on the insights, then it is all data and analytics. And we sit on a wealth of that.
Yeah.
We have lots of those information, be it the utilization rates, which providers are cost effective, what kind of conditions, be it diabetes or hypertension, that is plaguing a certain company.
Yeah.
And we work with the HR and your organization to curate a bespoke program on workplace wellness. We don't want a one-size-fits-all.
Sure.
We want to curate it based on data and analytics.
Absolutely.
If you have musculoskeletal problems, we want some ergonomics sessions for you.
Yeah.
If it is diabetes, maybe we have nutrition and how to chronic disease management programs on how to monitor and take care of those conditions.
Yeah.
So really, we want to curate bespoke programs based on data, analytics and insights for organizations. Yeah. Another point I thought I also like to share on how we are revolutionizing healthcare is by leveraging on technology. Now, we can't live without technology. My son was coming up to me and my old laptop, the old kind, right?
Yeah.
He was touching the screen, expecting the screen to move, and I'm like, hey, what are you doing? What are you doing, boy? That was my 10-year-old son, because they grow up with all this technology, and it's very clear. Technology is changing the customer, and not the customer changing technology.
Yeah.
We can't live without our phones today.
Yeah.
So one thing that AIA does is to leverage this technology, these digital health solutions, to be able to better service you and better partner you. Now you may be asking, how does that work? I mean, there's a couple of things on the employee benefits end. We have a e-benefits, which is a very well received employee benefits portal where you can check your clinics, get your e-card, visit the doctors, submit your claims. And then we have Vitality, which many of you are so familiar with. You get engaged and really encourage one another on that journey. And then we have telemedicine, like a WhiteCoat, really to provide you that healthcare. And you think about it, it is technology enabled through your phone, through an app or through a portal. And I really believe that it is, we revolutionize healthcare by leveraging on technology to make life better for all our customers.
Absolutely. Thank you so much for providing that context into data, technology, and most importantly, the insights that we do with the data and technology that we have available to us. Now, we're moving into our final segment, ladies and gentlemen, and at this stage, I would like to come over to you, Brian. Now, it was in 2018 when you founded WhiteCoat, and you really introduced us to this practice of telemedicine, which is a revolutionary digital healthcare service. So talk to us a little bit about what WhiteCoat does, and perhaps you can also lead us into how have you seen the demand and the adoption rate for telemedicine as you started out?
Sure. So I think we can all acknowledge that we've all been patients before. And if I were to put myself in the role of a patient in the past, I would have to take the time to travel all the way to the clinic, wait in line with other sick patients, wait again to collect my medication, and then wait and travel back home to recover. So that whole process on average takes 2 to 3 hours.
Yeah.
So what we've really done is to bring a new level of convenience to patients by redefining the traditional experience that patients experience in the clinic.
Right.
And this can be actually done through your mobile phone. So it's so interesting now how the landscape has changed. I mean, to Alvin's point, my kid ran up to me 2 weeks ago and said, Daddy, I'm not feeling well. Can I use your phone and see the doctor?
Oh, wow.
Right? If we look in the past, it'd always be,
Yeah.
I'm not feeling well, Mom, Dad, can you bring me to the clinic?
Right.
But now they're using their mobile phone. So it's really changed a
Yeah.
lot. And what we've been able to do through telemedicine is really bring accessibility to primary care services. And I think
Right.
to Dr. Alan's point, what we're trying to prove is that by providing timelier access to such primary care services without additional premiums associated with
Yeah.
after office hours, clinic charges, and by standardizing the rates, we can bring timelier, more convenient, and hopefully reduce the overall healthcare cost to
Right.
the patients. So what we've been able to do, and we're still actively monitoring it through data analytics, is that by being able to manage such conditions, whether it's acute or chronic conditions right at the
Right.
onset, and through ongoing monitoring, through data-driven technology,
Right.
we would actually be in the long run able to provide optimized management plans
Absolutely.
to nip conditions in the bud and hopefully reduce healthcare costs for the patient as well, which is very important.
Absolutely. That's a noble mission indeed.
And I think to your second question,
Yes.
how has the take-up been? I would probably share in the early days, it was really, really tough. We were in a very new space, and being a startup, we really didn't have much track record.
Yeah.
And it was very difficult for us at the start to really convince clients and corporate clients to really take the leap of faith with us.
Understand.
At that point in time, telemedicine was really nascent. A lot of patients were unfamiliar with the concept,
Yeah.
and HRs as well. And together with AIA, who really had the foresight in utilizing such solutions to benefit their clients, we actually partnered with them. And Alvin, Dr. Alan were instrumental in actually allowing us to provide a package
Yeah.
for patients that at this point in time has also come in very, very handy for them. And it's really in line with where AIA has been trying to transition from, instead of just being a traditional payer, to really guiding the patient along each step of the journey. So that's something that we've really appreciated working with them on.
Absolutely, and I think you've played a very critical role, especially given the kind of year we've had, where we haven't really been able to step out and meet a doctor physically, but to instill trust in such a process, especially when your own son comes up to you and says, "Could I have a quick visit to the doctor?" I think it really helps to build that demand, adoption, and trust into the entire process.
I would just like to jump in on
Please
Brian's
do,
story.
yes.
This is what's talking about his son.
Absolutely.
And in 2019, when we first signed up with WhiteCoat, I told my wife, my daughter was not well, can I use teleconsult to see the doctor for my daughter? And then my wife says, don't experiment on my children. That was 2019. But
Gosh.
today, the whole family uses it, myself inclusive. We all use it. It's so convenient.
Yeah.
Once you use it, I think you're really sold on the convenience and accessibility of the healthcare.
Yeah.
And really that thinking has really changed in a very short span of time.
Absolutely. I think apart from just the fact that it's the need of the hour, but it's also the convenience and the accessibility that has really, from your wife really being quite suspicious of you experimenting, to now the entire family having moved into it. So I think we're making progress in the right direction, and also at the same time tackling the need of the hour. Now, gentlemen, I'm mindful of the time. We've got just about 4 minutes left on the panel. So at this stage, I would like all of you to share with me your one key takeaway from today's panel discussion. What you believe that our viewers joining us today at AIA Health and Wellness Live should bring back home from this conversation. So one quick one. Alvin, perhaps I can start with you.
Yeah, I think a very simple message to our friends and viewers at home. We want to partner you in this journey, your healthcare journey, through 3 pillars. One, to help you know your health through assessing where that baseline is through our health screening programs, and then help you improve your health. So if your company organizes a workplace wellness program, please take advantage of them. Please maximize them. We would love to see you engaged and being healthy. And lastly, if anything does happen and you need hospital care, we want to be there for you. We want to walk through that journey, be it through medics or pre-authorization processes. We want to handhold you through that journey, because I know how it feels myself going through that journey. It feels helpless at times. So we genuinely want to partner you and really bring you through that journey with you.
Thank you so very much. Very nicely summed up. Brian, coming straight over to you.
Sure. I think for me, the biggest takeaway is that I think most organizations now know that employee wellness is not just a nice to have, but it's really fundamental. And there are very long-term benefits that I think most organizations will see in the long run, such as retention, productivity, and importantly, these benefits go beyond short-term to the long-term, which is why investment in these initiatives, mental wellness, for instance, that we're going to launch with AIA and AIA's whole suite of services is very critical at this juncture. So that's my big takeaway for today.
Absolutely, I think that's a strong and powerful takeaway. And Dr. Alan, help us sum up your takeaway as well.
Yeah, so I think for me, what I hope you take away from this is that you should ask for more from your health insurer. Right? We have always expected our health insurers to pay for our bills, and to me that's just table stakes. But really, your insurer can do so much more than just that. The insurer can help you to maintain your health, know your health, improve your health. When you're unwell, insurer can help you to make sure that you get access to the most appropriate care as quickly as possible. So we should really ask for more from our insurers than just paying for our bills. If you're a corporate customer, you should expect that your insurer should be able to help you identify issues that you need to pay attention to and provide solutions and insights that help you to improve the health of your employees and help to improve their engagement. So these are all things that insurers are well placed to do, and you should really be asking or expecting more from your insurer than just paying for your bills.
Thank you so much, Dr. Alan. You make us feel so empowered with your advice. So there you have it. Do talk to your insurer, have a very open, transparent conversation on what you need, what are your requirements, and they can actually help you with the data and insights to exactly what Alvin said in terms of knowing your health and improving your health. And this is how you can actually tap into AIA and its partnership ecosystem for happier and healthier lives and employees. So thank you so much. That concludes our panel discussion, and it's been absolutely wonderful to have all three of you. Thank you so much for joining us.
Thanks. Thank you, Aditi.
Thank you to all of our viewers for joining us as well.